By the time we were done, I was still finding bits of rotten flesh pasted against the back wall. Disclaimer: please do not watch this video while eating. Gynecologists, what is the nastiest thing you have experienced while working? I worked as a medical assistant in a gyno office, and the worst patient we ever had was actually really sad. She clearly hadn't bathed in about a week, and her underwear were stained. She claimed she was having trouble getting pregnant and had a bunch of eggs frozen and wanted a pelvic exam. The smell when she took her pants off was horrific. I'm fairly certain she had mental problems because she proceeded to tell me that she knew how to kill a man and get away with it, and could help me out if I ever needed it. Then there was the time I had a 98-year-old patient with severe uterine prolapse. It was horrifying and made me never want to get old. The most interesting thing I ever saw was a patient who was originally developing as a fetus with 2 vaginas, but they ended up fusing together, leaving her with a string of flesh that divided her vagina into 2 sides. She didn't know about it until she was 19, when the doctor had a difficult time putting in the speculum because he stuck it into the side of the string that was smaller. Before that, no one had ever noticed. I was doing clinicals at a large, inner-city clinic attached to a hospital. The first patient of the day was a woman in her 50s, who had recently had a vaginectomy to try and combat vaginal cancer. They had gone and removed her entire vagina. I've never seen anything like it. After we removed the packing, it was just a huge, gaping, dripping wand between her legs. There was absolutely nothing left of her female anatomy. The worst part was how terrible she felt about the whole thing. She refused to let her husband see anything, and was in tears the entire time, telling him he should go. She doesn't deserve to have him now. For the most part he just cried, attempted to hold her hand, and told her he loved her and could never leave. I had a Barthel Glen cyst, the size of an orange, that took over my vagina in a matter of days. Had to be hospitalized for 5 days total, and I couldn't walk or sit up. Excruciating pain, let me tell you. The doctor was so impressed by the size and I guess disgustingness of it that she invited student doctors or whatever to observe. It sucked. Glad it's gone now. But I'm sure I horrified everyone with that. I remember my regular obgyn shrieked when I showed her and said, "I can't fix this. ER now." My wife is an OB/gynecologist. The worst case she related to me was a female inmate that had such a bad case of genital warts that it was impossible to discern any specific anatomical structures. It was just a giant mass of warts and infected discharge. She was also 10 weeks pregnant and still sexually active. My dad is a gynecologist and told me this story. He treated a girl that had green, foamy discharge, who had it for months before coming in. He told her to take the medicine right away and continue it completely. A few weeks later she comes back in, and she still had the green foamy discharge. My dad asked why she stopped taking the medicine and she said, "Well, my boyfriend really loves the taste." I gagged so much. I was chaperoning a procedure my doctor was doing on a woman. She had an ingrown hair that had turned into a cyst on her labia. This doctor wasn't particularly good at cyst extractions and busted the sac. It sprayed in his face. I was retching and trying to console the poor woman at the same time. She was crippled with embarrassment. My mom's a labor and delivery nurse, so she sees quite a lot of cooch and swap stories with gynos all the time. I think my favorite story is the time she fished Easter grass, that plastic stringy stuff they stuff in Easter baskets, out of a vagina. She didn't ask, and the patient didn't explain. Friend of mine in judo class did some of his gynecology rounds at a local homeless shelter clinic type deal. He'd routinely horrify me at practice. Worst situation he was in was this homeless woman who had a rainbow of colors coming out of her vagina. Each color distinct. Didn't smell good. He didn't know what the hell to make out of it, so he called in his preceptor, who was equally baffled. They ran some tests on her, and it turned out she had something like a dozen simultaneous infections of her cooch. I was assisting with a pelvic exam in the ED. The PT's chief complaint was, "Gauze stuck in my vagina." I thought she was full of crap, because she was 6 weeks postpartum and had already had a follow-up gyna exam. But sure enough, we pulled out 3 nasty-ass 4x4s that had been in her vag since delivery. Now I have been a nurse in the ICU and ED for damn near 7 years, and that was by far the foulest thing I have ever smelled or seen. She is lucky she did not get toxic shock and die. Oh, our nurse here. This is kind of a long one. I was taking a call one night, and woke up at 2 in the morning for a general surgery call. Pretty vague, but at the time, I lived in a town that had large populations of young military guys and avid meth users, so late night emergencies were common. Got to the hospital, where a few more details awaited me. Perirectal abscess. For the uninitiated, this means that somewhere in the immediate vicinity of the butthole, there was a pocket of pus that needed draining. Needless to say, our entire crew was less than thrilled. I went down to the emergency room to transport the patient, and the only thing the ER nurse said as she handed me the chart was, "Have fun with this one." Amongst healthcare professionals, vague statements like that are a bad sign. My patient was a 314 pounds Native American woman, who barely fit on the stretcher I was transporting her on. She was rolling frantically side to side and moaning in pain, pulling at her clothes and muttering Hail Marys. I could barely get her name out of her after a few minutes of questioning, so after I confirmed her identity and what we were working on, I figured it was best just to get her to the anesthesiologist, so we could knock her out and get this circus started. She continued her theatrics the entire 10-minute ride to the OR, nearly falling off the surgical table as we were trying to put her under anesthetic. We see patients like this a lot, though, chronic drug abusers who don't handle pain well and who have used so many drugs that even increased levels of pain medication don't touch simply because of high tolerance levels. It should be noted, tonight's surgical team was not exactly wet behind the ears. I'd been working in healthcare for several years already, mostly psych and medical settings. I've watched an 88-year-old man tear a 3-diameter catheter balloon out of his penis while screaming, "You'll never make me talk." I've been attacked by an HIV-positive neo-Nazi. I've seen some stuff. The other nurse had been in the OR as a trauma specialist for over 10 years. The anesthesiologist had done residency at a level 1 trauma center, or as we call them, knife and gun clubs. The surgeon was ex-army, and averaged about 8 words and 2 facial expressions a week. None of us expected what was about to happen next. We got the lady off to sleep, put her into the stirrups, and I began washing off the rectal area. It was red and inflamed, a little bit of pus was seeping through, but it was all pretty standard. Her chart had noted that she'd been injecting 4 drugs through her perineum, so this was obviously an infection from dirty needles or bad drugs, but overall, it didn't seem to warrant her repeated cries of, "Oh Jesus, kill me now." The surgeon steps up with a scalpel, sinks just the tip in, and at the exact same moment, the patient had a muscle twitch in her diaphragm, and just like that, all hell broke loose. Unbeknownst to us, the infection had actually tunneled nearly a foot into her abdomen, creating a vast cavern full of pus, rotten tissue, and fecal matter that had seeped outside of her colon. This godforsaken mixture came rocketing out of that little incision like we were recreating the funeral scene from Jane Austen's Mafia. We all wear waterproof gowns, face masks, gloves, hats, the works, all of which were as helpful as rain boots against a fire hose. The bed was in the middle of the room, an easy 7 feet from the nearest wall, but by the time we were done, I was still finding bits of rotten flesh pasted against the back wall. As the surgeon continued to advance his blade, the torrent just continued. The patient kept seizing against the ventilator, not uncommon in surgery, and with every muscle contraction, she shot more of this brackish gray-brown fluid out onto the floor until, within minutes, it was seeping into the other nurse's shoes. I was nearly 12 feet away, jaw dropped open within my surgical mask, watching the second nurse dry heaving and the surgeon standing on tiptoes to keep this stuff from soaking his socks any further. The smell hit them first. Oh God, I just threw up in my mask. The other nurse was out, she tore off her mask and sprinted out of the room, shoulders still heaving. Then it hit me, mouth still wide open, not able to believe the volume of fluid this woman's body contained. It was like getting a great big bite of the despair and apathy that permeated this woman's life. I couldn't effing breathe, my lungs simply refused to pull any more of that stuff in. The anesthesiologist went down next, an ex-NCAA-D1 tailback, his 6'2" frame shaking as he threw open the door to the ER suite in an attempt to get more air in, letting me glimpse the second nurse still throwing up in the sinks outside the door. Another geyser of pus splashed across the front of the surgeon. The YouTube clip of David at the dentist keeps playing in my head. Is this real life? In all operating rooms, everywhere in the world, regardless of socialized or privatized, secular or religious, big or small, there is one thing the same: somewhere, there is a bottle of peppermint concentrate. Everyone in the department knows where it is, everyone knows what it is for, and everyone prays to their gods they never have to use it. In times like this, we rub it on the inside of our masks to keep the outside smells at bay, long enough to finish the procedure and shower off. I sprinted to the ER central supply, ripping open the drawer where this vial of ambrosia was kept, and was greeted by an empty effing box. The bottle had been emptied and not replaced. Somewhere out there was a godless bastard who had used the last of the peppermint oil, and not replaced a single effing drop of it. To this day, if I figure out who it was, I'll kill them with my bare hands, but not before cramming their head up the colon of every last meth user I can find, just so we're even. I darted back into the room with the next best thing I can find, a vial of mastisol, which is an adhesive rub we use sometimes for bandaging. It's not as good as peppermint, but considering that over 1/3 of the floor was now thoroughly coated in what could easily be mistaken for a combination of bovine afterbirth and maple syrup, we were out of options. I started rubbing as much of the mastisol as I could get on the inside of my mask, just glad to be smelling anything except whatever slimy demon spawn we'd just cut out of this woman. The anesthesiologist grabbed the vial next, dousing the front of his mask in it so he could stand next to his machines long enough to make sure this woman didn't die on the table. It wasn't until later that we realized that mastisol can give you a mild high from huffing it like this, but in retrospect, that's probably what got us through. By this time, the smell had permeated out of our OR suite, and down the 40-foot hallway to the front desk, where the other nurse still sat, eyes bloodshot and watery, clenching her stomach desperately. Our suite looked like the underground river of ooze from Ghostbusters 2, except dirty. Oh, so dirty. I stepped back into the OR suite, not wanting to leave the surgeon by himself in case he genuinely needed help. It was like one of those overly artistic representations of a zombie apocalypse you see on fan forums. Here's this one guy, in blue surgical garb, standing nearly ankle-deep in lumps of dead tissue, fecal matter, and several liters of syrupy infection. He was performing surgery in the swamps of Dagoba, except the swamps had just come out of this woman's butt and there was no Yoda. He and I didn't say a word for the next 10 minutes as he scraped the inside of the abscess until all the dead tissue was out, the front of his gown a gruesome mixture of brown and red, his eyes squinted against the stinging vapors originating directly in front of him. I finished my required paperwork as quickly as I could, helped him stuff the recently vacated opening full of gauze, taped this woman's buttocks close to hold the dressing for as long as possible, woke her up, and immediately shipped off to the recovery ward. Until then, I'd only heard of alcohol showers. Turns out 70% isopropyl alcohol is about the only thing that can even touch a scent like that once it's soaked into your skin. It takes 4 or 5 bottles to get really clean, but it's worth it. It's probably the only scenario I can honestly endorse drinking a little of it too. As we left the locker room, the surgeon and I looked at each other, and he said the only negative sentence I heard him utter in 2.5 years of working together, that was bad. The next morning the entire department, a fairly large floor within the hospital, still smelled. The housekeepers told me later that it took them nearly an hour to suction up all of the fluid and debris left behind. The OR suite itself was closed off and quarantined for 2 more days just to let the smell finally clear out. I laugh now when I hear new recruits to healthcare talk about the worst thing they've seen. You ain't seen crap, kid. As a medical student, I had to do a pelvic exam on a morbidly obese lady who thought she was in labor. After several attempts, I just could not get an accurate view with the speculum due to the sheer size of this lady. As such, I had to call my resident in for help. As the resident attempted to do a speculum exam on this patient, her first couple of attempts were unsuccessful, as mine had been. However, on her 3rd attempt she was able to pass the speculum into the vagina cavity, then the patient all of a sudden started screaming really loudly. We weren't really sure what had happened, but upon closer inspection, the woman's penis, or her belly fat, had become caught on top of the speculum and had actually gone inside the vaginal cavity. So in essence, her belly went inside her vagina. That is definitely the grossest gynecological thing I have ever seen. I worked for a family practice as an MA for a while. A patient who we had never seen before called the office, frantically trying to schedule an appointment because she was having lady issues. Whatever. We got her in the same day, and after the doctor had talked to her for a while, he told me to prep a pap room. When we walked into the room, the smell hit us like a ton of bricks. The doctor did a few throat clears and sat down at the end of the bed to start the exam. Well, after getting her feet in the stirrups he lifted her gown, and his eyes went from normal to about the size of dinner plates. This girl had the most severe case of herpes I had ever seen. Her vagina was swollen and a deep red color, covered in a severe outbreak. To make things worse, the piercing she had in her clitoris looked like it was being sucked in by her skin. Her vagina was oozing green and black gunk, and when the doctor inquired a perineal tear, she responded, "Yeah, haven't you ever heard of double penetration?" After the exam was over we had to convince her that her 4 current sexual partners needed to be contacted about their exposure to several STDs, even though, as she put it, it was too late anyways, because she never uses a rubber. I have never seen anything so disgusting in my whole life. It still haunts me. Thanks for listening to the most disgusting video I've ever made, so far. Now you know why everyone is telling you to use condoms. Again, huge respect to all gynecologists and nurses. Thanks for your hard work. Subscribe to this channel for more civil content. And stay clean.